Hello, everyone. I hope you've had a great, productive day. I know I did. I took a test today for my pediatric class. It was focusing on head injuries and chronic kidney disease, electrolyte imbalances, also acute kidney injury, things like that. And I did fairly well. Because I did well, I kind of celebrated. Went to the gym. Also had pan dulce, and if you don't know what pan dulce is, it's a sweet bread, and it's fantastic. If you haven't tried it, try it. It'll change your life. But anyhow, that's actually why I wanted to jump on here. I wanted to let you know where I currently am in the nursing program. So as I told you previously, I have 9 months left, and currently I'm in my pediatric theory class, and I happen to start my pediatric rotations on Sunday, and I'm going overnights. And so I guess I'm going to be feeling that true nursing experience because from what I hear, nurses start off going overnights, or it's kind of just what happens. But well, yeah, that's going to be my rotation. So I didn't realize that during nursing school, you may still have to work during the day. You still have to take your theory test and class during the day, but you will still be going overnights for your clinical rotation, which it's going to be an experience. I'm not gonna harp on it. I'm just gonna think, you know what? It's an experience, and let's get through this, and let's see if we can make the best of it. But yeah, so as I said, I'm in the pediatric theory section of my nursing program, and it's a fantastic field. If you love kids, and if you are the type of nurse that can see an ill child and want to just be the best nurse for them, this is your field. For me personally, I love kids so much that I don't like to see them ill. So it's kind of like how you would have a person that loves animals so much but will not become like a veterinarian. It's kind of like my feel for that because yeah, I take it pretty hard. But if you are that type of nurse that can handle that, I give you all the props in the world. And yeah, it's a fantastic field. And I learned a couple misconceptions actually about the pediatric nursing field. So a lot of people tend to think that it's a miniature version of treating adults, like a mini version of that. But turns out that's a total myth. So, when you're dealing with children, you're dealing with developmental changes and ages. So, like, you're not going to give the type of treatment for a 1-year old as you're going to give to a 14-year-old. There's different lab values. There's different weights. Medication is dependent on weight, and also you're not going to communicate with a 1-year-old or even a 5-year-old the same way you're going to communicate with a 14-year-old or even adult. So yeah, it actually is its own entity. You can learn some similarities about, like, they can have chronic kidney disease such as adults can, but it really is a field of its own, and there are amazing people in this field. And my teacher, like, he told me he was a NICU nurse. He was at a couple pediatric hospitals, and the way he talks about it, just he really has a heart for it. And yeah, it's pretty amazing. But yeah, I just wanted to let you guys know where I currently am, and remember that, like, if you do well on these tests, and treat yourself, do something good for yourself. But one more thing I did want to mention that my teacher did mention today is a good thing to remember is not to just study for the test, study for your knowledge. Because the more knowledge you know in this field, the better you're going to serve your patients. And if that happens to be in pediatrics, you will have more answers than not answers, and you'll be able to find things to help them sooner. But yeah, I hope that you guys have a great rest of your day, and thank you for listening.